So what are the potential downsides and risks of breast cancer screening? And so what should you know about breast cancer screening? I think there are really three important factors. One being that there is a chance of what's called false positive findings on a mammogram. So this could be any callback or other reason that a woman needs to come back for an ultrasound or another mammogram or other imaging. This can also require then a biopsy. However, after going through all of that, the conclusion is that there was only benign findings there, and so no cancer was found. This happens relatively frequently. Between age 40 and 50, about 61% of women will have a callback, and about 7% will require a biopsy and yet still not have a cancer diagnosis. So that's certainly a concern when we think about screening. We also think about false negatives. This is something where a woman had a mammogram and maybe shortly after having a mammogram in a month or a couple months was diagnosed with breast cancer. This is obviously also a very distressing condition and is affected by the breast density in terms of how sensitive a mammogram is for breast cancer. Fortunately, there are technologies that try to minimize this, but this is still a risk, and that technology is digital mammography. There's also the concern with breast cancer screening of overdiagnosis. This is something where a breast cancer may be found, but this is a breast cancer that is growing so slowly that it would not affect the overall longevity of an individual. And so this happens particularly in specific scenarios. It's a difficult thing to measure for us, but it is estimated that maybe somewhere in the order of 5 to 10% of diagnoses of breast cancer, maybe an overdiagnosis. This figure here on this slide also demonstrates, I think, a good sort of proportion of the women who come back for these false positives. So if we screen 100 women with a screening mammogram, 90 of those women will be told their mammograms are normal. 10 will be asked to return. Of those 10, 6 of them will come back with normal or benign findings and told to return to their regular screening. 2 out of those 10 will be asked to return for screening in 6 months rather than the typical year. And 2 of those women will be recommended to have a biopsy to investigate these findings more closely. So this is important as women decide to do their screening mammography.